Now you are.
So, Caitlin, I greatly apologize. That fabulous presentation was not recorded. I apologize. I thought that my Zoom account automatically started the recording.
All
right, she's just got to say it all over again. That's all.
Yeah. Right. Thanks, Mike. Okay. Well, with that, so Dr. Stephanie Palmino is going to start. So, Stephanie, if you want to just introduce yourself while I need to load your slides.
Certainly. Hi, everyone. I'm so delighted to see such a large group of people. I see we have 30 participants here already. My name is Stephanie Palmino. I have my doctorate in nursing. I'm a certified public health practitioner, certified case manager, certified dementia practitioner, and a nursing home administrator. And until 2 weeks ago, I was president of the Connecticut Nursing Association. Now I'm down to a board member. I've expired all my terms of office that I could do with the association. And I work with the Greenwich Department of Health on a part-time basis now. They called me back to work on COVID because I was the person who had developed the town of Greenwich plans for avian flu, SARS, MERS, the mass immunization plan, the nursing home plans, and all of that. So I'm back working on a grant for the next 18 months, and everything I do is COVID. So I was delighted to be asked to come and be part of this panel talking about the local impact of COVID-19 on working parents. I've done a lot of work with other groups like seniors. As soon as COVID emerged, I began doing weekly telephone conversation groups that ran for 50 straight weeks, and we covered every conceivable component of COVID. And they put together 3 videos, one with the town of Darien, and one with, I believe it was New Canaan, and including one that focuses on caregivers, which many of our working parents also are. I'm going to be having my slides advanced as we go forward, so please feel free to move to the next one.
Oops.
What I was focusing on initially was the regional and statewide challenges, and we've certainly had many. And I think one of the things that we learned as we went along the way is that COVID has brought out many areas where there is disparate impact. We had disproportionate effects on women, people of color, people in low-income jobs. We had people who are non-English speaking who were adversely affected. And this is not coming just from me. This was all part of a conversation under Labor Commissioner Kurt Westby here in 2021. But I looked also at the impact of COVID-19 on working parents, a report that was done by Catalyst in 2020. And it really pointed out a lot of things that will probably be no surprise to any of us, but they are mentioning. One of them was that there's a strong parental perception that being a parent really represents a black mark if you happen to be in the workplace. And I think the basis of this for many people in the workplace is that you have to sometimes make a choice between the needs of your children and family as opposed to the needs of your job. Now, when jobs were moved back into working virtually, I'm not sure that made it easier or harder because I moved my company into my office a couple of years before COVID. And it's not always easy to work remotely, even without the COVID situation and children and their schooling. Another impact that came out of that working parents report was that being a mother as opposed to being a father actually had a higher burden of negativity because the majority of caregiving and home responsibilities really still falls to mothers. So that's something that's part of our societal burden, but it's a real thing, and this report pointed that out. For those of you who might have been involved in homeschooling, I'm sure that you're very much aware of the major work impact that this had on a working parent's ability to carry out any work duties. There were constant disruptions. You may or may not have been able to deal with knowing how to teach I mean, people go to school for years to learn how to teach, and suddenly here were parents having to carry out this responsibility. Next slide, please. Going along again with the statewide challenges and the regional challenges, and I think this was brought up in the previous one, almost half, well, not quite in this context, but the overall perception, almost half of people who were working mothers who worked at senior level jobs had to contend with their work duties, childcare, and home management responsibilities. I'm sure that doesn't surprise us. And it's not only our senior level working mothers, it goes all the way down. But this particular factor pointed out a lot of statistics that I thought bore mentioning. 72% of senior level mothers and 42% of non-senior level mothers had to reduce their work hours or take leaves of absences while school was closed. Can you imagine what that does to your career trajectory? 65% of senior level fathers, notice that disparate difference, 65 to 72, and 44% of non-senior level fathers had to reduce their working hours to help with childcare responsibilities. Some, a lot, had to have people, other relatives, bring people into their home to assist with childcare, nannies, babysitters, family members, seniors, and of course this placed them at risk because especially in the early stage of COVID, seniors had a high risk and we didn't have vaccinations to protect people. Next slide, please. So a lot of mothers and fathers experienced anxiety and guilt for many different reasons during COVID and are still experiencing this. They themselves perceive that their work duties and their duties as a parent both suffered during COVID. It's hard to give full attention to both, and both really need full attention. Over a quarter of working parents had COVID-related losses, and that added so much grief to the worries they already had. How many of us, perhaps sitting right here, lost a loved one, a colleague, someone we knew to COVID? And this had tremendous stress. Being a nurse, I can speak to nursing is the largest workforce in Connecticut. And we had so many people suffering losses, and the patients that we dealt with, and so many nurses are in the target group that we're talking to today, young working parents. And that became such a big issue in nursing that the American Nursing Association actually formed a group to look at suicide, post-traumatic stress, and other things in nurses. And I have to admit, even though I do a lot of work in suicide, I had no idea of the degree to which suicide, alcohol and substance abuse, problem gambling became an even bigger issue during the COVID situation. And nurses, like everybody else, are dealing with stress in many different ways, some productively and some not productively. Okay. Another point about the anxiety and guilt is that working parents feared that they were going to be the first to be let go if cutbacks were happening. And in fact, that was true. The bosses are obviously going to be looking, at least until we were all discussing this now, at who were the most productive employees to keep. Okay. So if you were in a non-unionized facility, it would be, or organization, it would be different than if you were in a unionized facility. It depended on the philosophy of the organization you worked for and what kind of supports they had already imbued into their programs and organizations. We had a third of parents who actually sought social supports, such as the one that were mentioned in Caitlin's presentation. They considered moving, going to different locations, bringing other people in, as I'd mentioned before, to assist with their duties so they could get their work done. And over half of working parents had made choices that they had to leave their children home alone, unattended, at least during some of their working hours. And I can imagine that this must have been an even bigger problem for people who were in lower paying jobs, because it's costly to provide childcare that you have to pay for. And if you have to work, I mean, I ran into this as a director of nursing and administrative pre-COVID of people who felt that they had to prioritize their job over their children. But COVID brought this out to such a big degree. Next slide, please. So parents were, and they continue to be, very concerned still about school safety. When all of our children came into our homes to study, that had one set of problems. But now that people are going back to school, children are going back to school, there's a lot of concern. We still have ongoing COVID infections in different parts of the country, and even right here in Connecticut, we have very different rates of COVID infections. We have very different rates of vaccinations. And I do want to put my bias out there. I am strongly in favor of people being vaccinated. It is such an important component of being able to fight a pandemic. Okay. There is all kinds of intentional and unintentional misinformation, which makes it very hard for parents to actually know what to do, how to choose, how to make an informed choice. They have to make informed choices about whether to get the children vaccinated, about which vaccine may or may not be the safest, about what the side effects could be. So what I've done in my role with the Greenwich Department of Health is I put out a number of articles on all different facets of COVID, vaccinations, protecting yourself, vaccines, testing, vaccine safety, to try and help people make their best choice. And I don't necessarily say you need to do this. My approach is more, let's look at what the issues are. Not everybody has the same risk factor. Are you at high risk? Are your children at high risk? Are your parents at high risk? What puts you at high risk? And those are the focuses that I take in my discussions and in my articles and in various presentations. Like we know that someone is at higher risk if they're older, if they have underlying medical conditions, if they have treatments that they're in the process of, or medications that compromise their immune system. We know that people are at higher risk if they're Black, Hispanic, or one of the indigenous populations. So there are lots of different people whose risk factor is far greater. Now, early in the pandemic, parents and many people thought that children were not going to be affected by COVID. And in fact, this is not true. Children are infected by COVID in the same way that adults are. They carry the same viral load as adults. They can pass the disease along the same way as adults, but children don't tend to get as sick as other older adults do. Their immune systems may be a little bit healthier. The majority of children, 100% of the children that I've been monitoring since I became a contact tracer right at the beginning of COVID, I had many children, but they were very mildly ill, and every single one of them recovered without incident that we know about. And that's a very important factor because we don't yet know the long-term effects of COVID. And that's another source of concern, not only for parents and adults, working parents, but for people in general. We're finding studies that are showing that even if you had no symptoms, you were completely asymptomatic, didn't even know you had COVID, that when x-rays and other testing, diagnostic testing is done, damage is being seen in organs, in blood vessels, and things of this sort. So it's another thing to think about and in making your decision. But that's a tough decision for parents to have to make, not only for themselves, but also for their children and sometimes for their parents. And my children are all 50 or close to it. So it's way back from me, but I can remember quite well how neurotic I would be about anything that could be a potential concern to the health or safety of my children. And here we are with a pandemic, which is worldwide. It's a novel virus, which means it's new. We don't know enough about it. We're learning all the time. The other thing that has been really a focus to us is the changing infection control guidelines. When COVID first started, a lot of guidance came out, and then as more was learned about COVID and the transmission, and vaccines came out, and misinformation came out about treatments that were completely useless, but many people believed in. There were different pieces of guidance that came out and different groups giving that guidance. So that added a tremendous amount to the concern and the anxiety of parents. And just recently, in maybe in the last month or so, you've probably been hearing a lot more about the numbers of infected children and children in pediatric ICUs, children who are being intubated, and children who are succumbing to the disease. And that's certainly a concern. But when I do my contact tracing, I always share with the parents because I know they're anxious, because especially if the children aren't vaccinated, I know they're very anxious about this. I share what I said before, that I have not yet had a single child who has been severely ill and not lost a single child here in Greenwich, Connecticut. And I hope that reassures them, and to a very large degree, they say it does. Could I have the next slide, please? So Caitlin had mentioned the sandwich generation, and that is a tremendous issue for the working parents that we're talking about here today. Many of you are in that sandwich generation, and that adds not only emotional stress, it's physical stress, it's financial stress, because many times you have to financially help support people or organize the services and benefits they're entitled to. You may be running back and forth to see parents or grandparents in addition to what you're doing in your own home, and all of that carries an emotional toll. But one message that I made very clear in one of the presentations that I had done, the video presentations by I think it was the Darien group, is that you have to take care of you before you can care for others. It's so important. It's like being on an airline or an airplane. If the oxygen drops, you're told, put your mask on before you try to help anybody else, because if you fall, you're not there to help anyone. So that's such an extremely important thing. So how can you help yourself? The support groups that were mentioned before, there are so many that are available. Many are online, many are now in person. There are all kinds of self-care programs you can go to. It's so important that all of us remember to eat, to drink our water and fluids, that we take time to exercise, and that we get proper sleep. You'd be surprised at how many people don't eat properly and don't drink. And I'm a prime example of that. I could be on the computer from morning till evening, barely even taking a bathroom break. And unless my husband brings me the glass of water, okay, I'll often forget to even drink. So these are very important because all of this will help you deal with your stress. I'm also a big believer in things like meditation and yoga and aromatherapy, the deep breathing and controlled exercises that help you level your body out. Imaging, I use these all the time, and I can't tell you how helpful they are. I'm also a strong believer in what's called cognitive behavioral therapy. And as our people were signing in, I saw that we had a number of people there with social workers and health professionals. For those who aren't, cognitive behavioral therapy is an approach that helps you deal with situations by changing how you think about what you're in the middle of. And if you could change how you think about something, you will change how you react to it. So if you have a child who is ill and your mind is going to, oh my God, my child might die, there might be permanent lasting damage, your anxiety level is probably going to be up here. But if you can turn that around and think, okay, my child has COVID, but the vast majority of children come through this with no damage that we're aware of at this point, they recover well, then you're going to think about that differently. Your anxiety level is going to drop down. So try that. It's tremendously helpful. I, again, use that in all areas of my life. I'm also a strong believer in the power of pets. Pet therapy is used in hospitals and all kinds of institutions. I have down to one dog now, but my pets have been such a tremendous source of support. And they also do things like cause you to have to get out of your house and take a walk if you have a dog. Many times if you're anxious or depressed, you don't want to do anything. But if you have a pet, you have to. Just stroking an animal's fur has scientifically been shown to reduce your stress level and your blood pressure. Watching fish in a tank is very calming. And then again, studies have been done about that. Watching a bird. If you don't have a bird, look out your window and find birds out there. I feed the animals in my yard specifically because I find it so comforting. My neighbors may or may not like it, but we have a raccoon, 2 raccoons, a possum, we have a skunk, we have a couple of cats that don't belong to us, and all kinds of birds. And I find it so relaxing to watch them. It's free, it's easy to do, and you can do it anytime. And then for those who are religious, religious support can help you find a resilience and to tap into a resilience that you have. And it's remarkable how many people are out there to help support you if you reach out and let them know that you need it. Next slide, please. Working parents also need more work-based support services. How many of the companies that we work in have programs that help you if you're having a difficult time? The employee assistance officers, someone who you can go and talk to. It's so important. And I think it's such an essential service always, but I think during COVID, programs like that were even more needed. I don't actually know how many companies have that, but I do know from companies that I've worked with that even those that do, people often don't know what they have available. They also don't necessarily know that what you speak to those people about is supposed to be confidential. Now, in some places, the employee assistance officers are reporting to people under human services or your human resources organizations. And I know that's been an issue in a couple of companies because people don't want to come and share their most intimate worried concerns if they think it's going to get back to the people who are in the hiring and promoting and kind of a business. So organizations can look at that. Working parents would benefit so much if we had better communication. What benefits can you as a working parent count on in your organization? What is simply not going to be possible in your organization? For instance, do you have health benefits that include counseling? Are you able to have a flexible program? Is your company willing to consider job sharing? So one person takes half the job and one person takes another and they each work half time. Some companies, if they have a layoff, are going to lay people off, an entire person. But other companies have used approaches like not laying anybody off and everybody reducing hours so that the problem is shared and nobody is overly penalized. That's a wonderful thing. Changes are also needed so that parents aren't faulted on their job because they have caregiving responsibilities. That happens so much more than we would like to know. And part of it may be a subtle bias that we're not even aware of. But if you've been a parent and now your children are grown and you're no longer a parent, and you may think, well, why am I carrying a greater workload than Mary Jane just because she has children? But if we can again go back and think about what it was like for us when we had young children, that can help. And this can be part of a change of the philosophy of a company. And those kinds of changes come from the top. We set a culture in every company we have. There is a culture. I don't know what else to call it, but that can be changed. Next slide, please. So Governor Lamont implemented the Back to Work Connecticut program. And we had long-term unemployed people, 10,000 people who were now going to be able to receive a one-time $1,000 payment for obtaining a new job. I'm sure you've all heard that many people have complained that because of money people got, many people were not willing to go out and look for jobs. And we have many jobs even today that can't be fulfilled. How many people know about this? Are they actively moving toward it? Okay. That program also reinstated job search requirements. In order to get money, you had to be doing a job search. This program eased the access for those who had lost their jobs. It included components about obtaining new jobs and how to retool your skills to meet a job that maybe was different from the one you had if you lost your position. It has components in it about workforce development opportunities with fair minimum wages. And that's so important. I'm of the the group that feels nobody should have to work more than one job just to make a living wage. And we have so many people who work multiple jobs and still can't support their families. And as an administrator in a healthcare facility and as a director of nursing, I had so many people of the young parents' age who had to work more than one job just to support their families. And this program helped that and is still helping that. It also covered the cost of doing job searches. Now, you can do job searches online, you can do job searches in person. You have to sometimes pay to go out and get an interview, but all of this was covered under the Back to Work Connecticut program. Next slide, please. This program also eased access for those who had lost their jobs. The governor addressed obtaining affordable childcare. Now, what a major issue this is. As the president of the Nursing Association, we had met with the governor and went through a number of issues. And I do want to say, in nursing, we currently have 5 generations of people working, and many of them are in the age group of the young working parent. So this was a major issue. What he did at that point, I thought was wonderful, is that he worked to create childcare centers near places that had healthcare, because healthcare was such a priority during COVID. The hospitals were overrun, the intensive care units were overrun, the nursing homes were in closure, and there were tremendous difficulties there. So if you add to the compounding problem of everything related to COVID, and you had the problem that somebody's child had to be cared for, or they couldn't come to work, this was a significant issue. So the government used $210 million of federal funding under the American Recovery Act to invest in increased early childhood programs. Now, that wasn't just centers for it, but other ways that childcare could be improved so people who could work could actually go to work. Big difference to be able to work and then to be able to get there because your children are there, and hopefully not being left home alone unattended because you need to go out and earn some money. If we want to, Governor Lamont had said in 2021, if we want to grow our economy and help our families return to work, we need to support childcare workers. And is there anyone here that doesn't feel that's the case if you have children? Next slide, please. So what are some of the strategies that we could use to create better workplace environments? And again, a lot of these strategies came from a number of different sources, but predominantly Catalyst, which is in my resources at the end of the program. They looked at this from many different angles, and it was a good resource. I was happy I found it. I was not familiar with this resource before I was preparing for this program. Okay. So some of the strategies that we can use or implement to create a better workplace environment is to improve our leadership. A lot of leaders rise to leadership positions without benefit of actual leadership training. I know that was my case. I was so fortunate that so many of the things I did along the way worked out so well, but until I got to my doctorate, I couldn't really tell you why they did. I had no idea. What I learned is that I had picked mentors who were good leaders. What I like to refer to as the transformational leader, which to me is the most ideal type of leadership. But I emulated what they did without even realizing it. So if we can actually train our leaders, educate our leaders in different organizations to be better leaders, to have better visions, to learn how to communicate better, to address things like workplace diversity, the inequities that we've seen erupt during COVID, to improve communication and support systems within their workplace, what a great benefit that would be. We need to reduce the social inequities between working fathers and working mothers. If you think back to the figure I showed at the beginning, there was a pretty significant difference between what working mothers and what working fathers had to do to leave their job, to cut back. And if we all know that there's a glass ceiling for women, that if you, and particularly if you have children, it's very hard to rise up a corporate ladder because you can't do what fathers do. How many mothers, if they're not in a well-to-do position, can afford to go on business trips, take a trip out of town? Fathers can do that because mothers are home taking care of the kids, but there are also fathers who are stay-at-home fathers. So it's not completely separate, but the statistics are that it's very largely mothers who take the brunt of not being able to advance in their corporations or in their jobs because of the social inequities between working fathers and working mothers. Coming back to leadership again, we need to have leaders who lead with empathy and compassion. We need that from the top down. We need people who can understand what people are going through, who can make business decisions that look not only at the bottom line of a company, but also at the welfare of the people who work for them. Our employees are our most valuable assets. Yes, we're all here for whatever the basis of the company is, whether it's healthcare or a product. But without our employees, we are very greatly diminished. We need to, and again, this is a leadership issue, we need to include team members in the decision discussions when we have to make changes during times of crisis. All the decisions, not all, a lot of the decisions tend to be made by upper echelon people who may or may not remember what it was like as they were climbing the ladder and what it's like in the front line. And as a director of nursing, administrator, CEO, I always look to the frontline people when I'm making a decision because I know that they have a very unique point of view. And I think this is so important and so frequently overlooked. Many of the companies that I work for would bring in high-priced consultants, and now I'm one of them. But one of the issues was that they would bring in high-priced consultants, but they never asked the right questions. They would come in and they would talk with the leadership people and come away with something when we already knew what was needed because we talked to the frontline people. So I would always tell these consultants, why don't you meet with this group, meet with that group, hear what they have to say. Sometimes they would and sometimes they wouldn't. Their outcome was consistently better if they took the input and heard what the frontline people have to say. Okay. We need to be flexible and look at innovative approaches. Is there anything we cannot do in our company? Like I mentioned before, having job sharing, having people not lose a job, but maybe everybody reduce their hours. Can we change how we're doing things? Can we expand the hours of work? Can we go from a 5-day-a-week job to a 7-day-a-week job and share that responsibility out? We need to look at so many things, including productivity and outcome and the bottom line. Okay. We need to support assertiveness training and negotiation skills in women. Women, as a rule, tend to be less assertive, and the negotiation skills, that you can find numerous articles to support this, are less good in so many women. Now, I think that's improving with our younger generation of women. I find them to be much more assertive and to have improved negotiation skills. But there's so much that we could all learn in this. And I have to say, one of the most valuable courses I took at my doctoral level was a program that was shared between nursing and law. And it was a program on communication and on negotiation skills. And there are so many things that you just don't think about. And women in particular don't think about. So I would suggest look up some of those things. We also need to expand psychologically safe workplaces for working parents. A parent should be able to come in and not feel their job is on the line because they're a parent, not feel their job is on the line if they have to take time off to care for an elderly parent, if they need some flexibility, if they themselves become sick. We don't want sick people coming to work, and yet many working parents will come to work sick because they don't want to lose their job or feel that their advancement opportunities are going to be compromised because they're human. So these are things that we could do, all of us could do, every company could do to improve the workplace environment, not only for young parents or parents, working parents, but for everybody. Next slide, please. So I have a couple of slides in here which include a number of uh, resources and references and things of this sort. There may be 3 of them. I believe you're going to be getting the slides, so I would suggest you look at them. I was re-listening to the Darien COVID Mental Health Wellness series, which I think I had 3 programs in that one and one in the Buchanan one. But there were so many good pieces to that. Talking to parents, how to talk to your children, how to involve your religious leader. Wonderful. If you get a chance to just put these links on, this link, it will just play one right after the other. I think there might have been 10 or 15 different short topics, but they're excellent. Okay. So that's what I had to say. Are there any questions? And there were 3 or 4 more slides of resources. Okay. And here. And of course, Caitlin presented such an absolutely wonderful one. And I wanted to commend her. What a fantastic presentation, Caitlin. And not only about the hub, but about everything that you talked about. Just wonderful. So that's what I had to say. And does anyone have any questions?
I think, Stephanie, we might wait till the end so that we could, because I just want to make sure that Terry has had a chance, to do his presentation.
Absolutely.
Yeah, so stay tuned.
Thank you, everybody. Stay safe.
Terry, I'm going to go ahead and start your slides. So whenever you're ready.
Terrific. Thank you. And good morning, everyone. Great job, Caitlin, Stephanie. Really enjoyed that and your presentation. So I'm going to take a little bit of a different perspective. My name is Terry Henry. I'm Chief Sales and Marketing Officer for Waveney Life Care Network, which I'll talk about in 1 minute. I'm also a certified Reiki master, and I'm training to become a certified meditation instructor. And if you're wondering why I'm bringing that up now, it's just that COVID was such an unprecedented experience for many of the families that we see and many of the folks who are part of this sandwich generation, that the self-care aspect of rebounding from COVID is something that is unbelievably important. So I'm going to spend some time talking about that today. And I want to also talk about some of the observations I've been making in interacting with some of the folks who represent the sandwich generation through my dealings with Waveney. And I'm going to take a bit of a more I'm going to take a different perspective here, because I believe that human potential is really a force of nature in itself, and that many of us are coming out of COVID actually more empowered than we believe. So if we could just forward to the next slide, please. So first on Waveney Life Care Network. So Waveney Life Care Network has been around for almost 50 years. And think of Waveney as a clearinghouse. It's a continuum of care. We operate out of New Canaan and Wilton, but we touch many families across the tri-state region and increasingly from other parts of the country. It's a full spectrum of care in terms of the services that we offer. And as a result of us offering these services having to do with independent living and assisted living, memory care, rehab, telehealth, skilled nursing, home care. As a result of Waveney being this clearinghouse of services, I guess I personally counseled over the past 2 years over 300 families, and our teams have, again, through the inner workings of our services that we offer, counseled in excess of a few hundred families. So we have heard the voices. We have firsthand counseled a lot of these families, not necessarily to interact with Waveney, but much of what we've been hearing has been COVID influenced and COVID driven. And so what I want to talk about today are what some of those voices are and how best to respond to the fact that we've experienced COVID. I personally believe that, COVID happened for a reason that we may not know uh, much about today, but that if we're coming out of the COVID phases, and these phases seem to be ongoing, the same people that we went into the COVID experience, then we may be missing an opportunity here. So I want to sort of encourage all of us, especially the families who are part of the sandwich generation, to remember that the human potential that we have is actually a force of nature, just like the sun, the moon, and the stars. Next slide, please. Terrific. So this is one of my favorite quotes. Nothing ever goes away until it teaches us what we need to know. And in counseling many of our families, I have to tell you, sometimes it's not what happens to us, but how we respond to it. And as Stephanie talked about, how we think about it. So our perspective on COVID and some of the negative experiences that we've had, COVID has been a test for many of us. And each of us is on our own journey, leading our families, trying to be the best version of ourselves that we can be. And as we're going through that, it's just important for us to remember, this is why I want to highlight this, is that what can we learn and what things about COVID have made us better people and can actually empower us more than we anticipated being impacted by COVID. Next slide, please. So, COVID really provided a call to action for many of the families that I've spoken to and counseled in terms of what their next steps are, not only throughout COVID, although Waveney was closed, as Stephanie indicated, for probably 90 or so days, but we reopened in time to capture a lot of the feedback, the observations, the angst, the pain, the worrying that many of these families have undergone. Our main demographic are women between the ages of, I'd say, 45 to 65. And so many of them, in dealing with issues related to the care and safety of their mom and dad, were equally disrupted in terms of what they were able to provide and their availability for their own kids. So, excuse me, the onset of COVID and having to deal with making decisions about mom and dad or their kids came on suddenly in some situations. And in some cases, especially related to mom or dad, it was a gradual onset or either a predictable or unpredictable decline. And it impacted their lifestyle, home management in terms of providing medication, maybe providing personal care and medical care, which put a lot of our folks in the sandwich generation in a really uncomfortable position in terms of having to deal with mom or dad's care, as well as the personal care and needs of their kids. And it certainly pushed our families and our clients out of their comfort zone. So it was very unsettling, to say the least. And the severity of how COVID impacted people also varied in terms of what people were able to handle, respond, and manage through. And for some, it was overwhelming at first. Some were more adaptive, some were more resilient. And not everyone had someone to share it with. Excuse me, there was a lady who lived in Westchester, New York, and her daughter lived in New York City, in Brooklyn, New York. Her daughter actually, in order to make enough time to care for her mom, had to quit her job, commute to Westchester every day, and be back home to pick the kids up from school. And if that's not unsettling, I don't know what is. As if moms don't have enough responsibilities, COVID really amplified the sense of overwhelm and amplified the sense that, if you didn't have someone to lean on, if you didn't have a partner, a spouse or friend to help, for many it was very overwhelming. And many of our folks came in and expressed the fact that they were really at the breaking point and sought some of the resources that we have readily available today. Now, the demands are for a lot of these families ongoing, and some of them may seem to take on a life of their own, and they may be more intermittent where good planning and good preparation has put them in a position where they're not as involved or as overwhelmed as they were before. Next slide, please. So stress management, one of the biggest stressors has been, according to the families that we speak to and our clients, some of the role reversal. We've all, to some extent, some of this is maybe ego driven, but we've all sort of developed a self-identity. And we've all, assessed our own capacities and skills, and we've come to a point of comfort, many of us. But COVID presented a situation where we became untested, and we were pushed in areas both emotionally and as a practical matter, where we began to, in some cases, question what we were capable of. And for folks in the sandwich generation, many folks expressed to us, is this a zero-sum game? Are the gains that I'm providing for my mom and dad, are they necessarily taking away what my children need in terms of my own availability, leadership, and guidance? And that was a big conflict for many families and continues to be. It allowed us to question our skills and competencies, and I'm going to talk about responding to that in a minute. But as it relates to managing through COVID, if you're a parent as well as caring for your parents, there is no well-established playbook that works necessarily for everyone. The cases that we've seen differ in terms of severity and in terms of the number of issues and the scope that they're dealing with it. Just as we're different biogenetically, many of these folks are facing stresses that are just sort of particular to their own case and not necessarily something that they can have the opportunity to get a help on, because there is no one stress and it doesn't affect all people equally. So there's also a sense of ambiguity in that there is no fixed way to respond or to resolve some of these issues, but it's clear that there are a lot more resources out there today, and some of the folks on this call are an example of that. Not necessarily a safety net for immediate issues relating to mom or dad that require immediate attention or intervention. Falls, a sense of isolation, or realizing that mom or dad may be isolated if they're of a certain age, if a parent has begun to wander. These are all immediate issues, fires that need to be dealt with and resolved. And so many of the families suffered from having to be faced with these issues and not necessarily feeling a sense of preparation. For a lot of the families who actually decided to bring mom or dad home to live with them when they actually have kids themselves, presented a lot of, I think, dialogues and stressful situations, according to what we've heard, in terms of who's in charge here. The role reversals weren't necessarily complete, and a lot of the folks who came in talked about how their own children would question the leadership of their parents as we, the sandwich generation, were dealing with and just trying to manage the dynamics that we have with our parents. It was an uncomfortable situation and continues to be for many of our families. So that dynamic is still sort of out there, and it is impacting a lot of our families. And then many of the folks, the last point in the first section there, talked about a sense of loss, a sense of grief in terms of their own sense of control of their lives, their own sense of not being able to take care of themselves as much as they would like. And there is a perceived sense of loss, and hopefully many folks are finding the resources that we talked about today to help them regain that sense of confidence and that sense of control. And obviously the stress can stir a number of different mixed emotions: fear, guilt, a sense of exhaustion. Am I always available? Do I have enough availability to deal with some of the stresses that are on me? A sense of inadequacy, because folks, again, are pushed necessarily out of their comfort zones and dealing with two generations and being in the middle. A sense of if they're wondering whether or not they can do it or continue to do it, since we don't have sort of finality or closure on where we are with COVID. We're managing it through the best that we can, but there's no sense of necessarily closure on that or finality. And then, of course, a sense of resentment if someone has felt they haven't been able to capture some of the time that they feel has been lost, and then a sense of confusion in some cases also. Next slide, please. So I want to talk about a shift that's occurred and a shift that continues to occur among many of our families, and a shift that we encourage folks to embrace. So the folks who expressed fear, it's often been helpful for them to sort of embrace a sense of empowerment, because fear in a lot of these cases has come from not necessarily knowing what to do or how to go about doing it. But once you educate yourself and you learn a little bit more about who can help you and how to manage out of the situation, you do develop a sense of empowerment. And we see a lot of our families who come in for either our community care through visiting nurse and hospice, that's now a part of our organization, or through even folks looking for independent or assisted living or rehab services. We do see a sort of renewed sense of empowerment now that folks have had a chance to better educate themselves. A sense of guilt that folks once felt has been replaced in a lot of cases with a sense of responsibility. Whereas there are unpleasant decisions or unpleasant feelings around folks feeling like they've had to transition mom or dad to assisted living just because home was no longer a safe or appropriate place. So that sense of guilt in a lot of cases has been replaced, now that we fast forwarded a few months, with a sense of validated responsibility. I did make the right decision. And so those feelings of guilt have become less and less as time go on. A sense of exhaustion was, quite common. And now we see it being replaced with a sense of acceptance, in the sense that, you know what, I can only do what I can do during the course of a day. I'm only one person, and I am where I am. And I have to accept that. And knowing that I'm doing the best that I can and I'm still invested and still engaged, folks have had a sense of acceptance, and this has reduced some of the stress. And these are things that we obviously encourage. A sense of inadequacy a lot of times has been replaced if people are able to be resilient and power through with a sense of accomplishment. And a sense of confusion. You can eliminate fear and confusion with action and proactivity, and we felt that to be the case. Now, personally, I have been I've been practicing transcendental meditation for over 25 years. I am about to be certified to be a certified meditation consultant, and I can tell you that a lot of the stress, a lot of the experiences, some of the negative experiences that people have felt, I felt more throughout COVID a sense of empowerment. And I've had to be that for our families, for my family, for my colleagues. And I think we all have a sense of the importance of self-care. Caitlin said something a little earlier that really struck me, and that is that pre-COVID, I guess more than half of families were not receiving proper mental health care or treatment. And that was alarming to me. And I have to believe that fast forward, a lot of folks have been negatively impacted by COVID. And so to me, this element of self-care is even more important. And we have to be more proactive and more mindful of it. So in terms of the resources that are out there, obviously the hub is certainly one of the greatest examples of that. Tipa Snow is on YouTube and throughout the internet talking about how best to deal with mom or dad's transitions, if not to home care, but to other resources outside of the home. There are, as we talked about, many social networking and support groups relating to dealing with and responding to COVID and becoming more resilient. There are counseling resources out there. I just want to, as Stephanie did, to just kind of reassure that the self-care actions that we can take can absolutely mitigate some of the feelings that we've had through COVID. Sometimes it's not necessarily the challenge, but it is how we respond to the challenge and how we're feeling about the challenge that gives rise to our emotional state. And I can tell you firsthand that meditation has allowed me to quiet my monkey mind and has allowed me to focus on what's really important and what the truth is. There's an old saying, Florence Shinn was an old metaphysician in the 1940s, and she said that when you pray, it's like picking up the phone and calling God. And your intuition is God calling back. So you can only really access your intuition if you're proactively thinking about relaxation techniques and meditation and yoga and music. Music is really appealing to me because it has a fourth dimensional quality. It affects the amygdala, which is our emotional brain. And there are so many different ways for us to take back control of how we feel, which is going to give rise to how we act and interact with other people. I want to emphasize that if you have kids or have access to kids, or you can borrow someone's kids, they're a great resource because guess what? Kids see the truth, and kids don't have the reservations that we have, and kids can remind us about, again, this sense of human potential being a force of nature that's within us. And I guess what I want to encourage folks to look within for a lot of what we have, because we already are equipped with a lot of the resources and the strength and the power and the resilience that we need. We don't necessarily have to rely on outside or external forces to provide that for us. A lot of us, if we can quiet the mind, and however you do it, through meditation, exercise, cooking, art, culture, interacting with people that you love, taking some quiet time, all of these are self-empowering, and all of these types of activities can help us be more resilient and successful through COVID. Next slide, please. So we come full circle, and I want to just urge and encourage us to what the good things about COVID are. And there are good silver linings to COVID. Many of our families report the fact that were it not for COVID, they would not have developed more of a sense of patience, empathy, trust, believe not only in themselves, but in their inner intuition and a belief in their self-capacity and an ability to persevere and to overcome. It's also helped a lot of our folks' sense of collaboration. Many are now talking to family members, working through these crises that they didn't talk to or didn't interact with very much over the past few years. So COVID created that opportunity as well. It's developed a sense of forgiveness. Sometimes when we look back on our relationships with mom and dad, we're able to forgive because we have a better sense of perspective. And COVID provided the catalyst for this and the opportunity to do this. Many of our families feel more resilient and more empowered. They're more determined. They have a sense of accomplishment because they've worked through COVID, and what could be worse is the sense coming back to us. And it's increased their adaptability, their flexibility, and they now have a more open mind about any challenges that could come down the line. But COVID really served as a testing ground, and a lot of folks have passed the test and are passing the test. And it's a tribute to the folks on this call, and we're providing the resources that people need to feel that they can become more adaptable and overcome. And, frankly, a sense of gratitude. Things happen, I do believe, for a reason. And, all the negativity aside, I do believe that there was a reason that COVID came into our lives, and that many of us have the ability to overcome it and come out the other side much better people, much more informed, much more educated, and much more empowered. So I'm going to stop there and thank you folks for your time and ask if there are any questions, observations, feedback.
So Harry, that was incredible. That was just really, really great. And I think that all three speakers really sort of complemented each other in terms of the content. Before we get to questions, I would like, because I forgot to push the record button, I would like Caitlin Comet to just reintroduce herself and then remind people who may be listening to this recording that your slides would be available.
Sure. Hi, everyone. My name is Caitlin Comet. I'm a program coordinator for the Hub. We are the Regional Behavioral Health Action, or RBHAO, for Region 1 of Southwest Connecticut. And our slides will be available to be shared out. And our slides have information about who we are, our priority report, mental health in adults in our region and our state, as well as what resources we have.
Great. And I would like to, as the facilitator of this meeting, I'll take the opportunity to ask a question. So Terry, you had, in the beginning of your presentation, right before you shared a quote, that great quote from Pema Chodron, you said something about the human potential. And I don't know if you're able to repeat that, but I thought that was really interesting about what the human potential.
Yeah, so, I think we've all been raised in a very Western-oriented culture that focuses on achievement and technology, and a reliance on forces and resources and things happening outside of ourselves to improve ourselves. I do believe that we've been encoded, each of us, with a destiny. I do believe that we've all, in a quiet moment, if we give ourselves, as Caitlin and Stephanie were talking about, more quiet moments of self-care, we'll be able to better hear what our destiny is and how we're more than able to overcome any challenges that we face that, by the way, are put in our way to get us to our destiny faster. If things were easy, would we grow? Would we develop? No, there'd be no incentive. There'd be no reason. So from my perspective, I truly believe, so one of the things that I've been doing as I'm getting my meditation certification, I've been leading meditation classes throughout Fairfield County and Westchester. I've been doing that for years. Now, I was trained in transcendental meditation, but that's not the style of meditation I teach because it's not necessarily something that's easy for people to see. And one of the things that's come back to me from some of my students is that they now, once they've quieted their minds, they now can see and feel their own human potential, which for some reason was in the clouds. You know how on a cloudy day you have cloud cover? Some of the things that we've been talking about on the panel discussion pushes the clouds away, and it allows people to see and feel the light and what they're able to actually accomplish and the truth about themselves. And it, and one of the great things is that it's sort of a self-initiated, self-driving force, and it sort of feeds on itself. It takes on a life of its own. Not that we're discounting the importance of families and folks outside of us, but until we can see and feel the fact that we have what we need already inside of us. We just have to actually be able to recognize it and accept us. Marianne Williamson had another quote that was something to the effect of, our fears have to do not with what things that we're afraid of and negative. Our fear has to do with our acceptance of the fact that we're greater than we've actually believed. So it's almost fear of the good unknown. So, I mean, some of the things that we've been doing in our lives to cope with COVID, we need to do more of those faster, and if possible, include other people in it. And I think that's going to create this sense of greater human potential to help us overcome this. I don't know whether I answered your question, but I just thought I'd go there.
Yeah, no, I think it is important, and it leads me to ask Stephanie a question about, in terms of, you talked about different strategies and certainly making the workplace, and I know workplace a better way to address things in their staff, making things, accessible resources and things like that. I wondered if you might speak to, sort of how the leaders themselves can sort of seek that. I know on this call, we have a lot of local public health leaders. And, just as Terry talked about, having to dig deep inside to find the strength to be able to lead and assist people, all that. So I just wondered if you had something to talk about that.
Well, I think what I've learned along the way, as I said, I've been a nurse for 53 years. I've been in management for probably 40 to 45 of those years. And like many people, you kind of find yourself moving into management for no particular reason. As I said, I did not have training in management, but I learned along the way, not only from the people who did things right, but from the people who did things poorly. And my thinking would be, I don't ever want to do what that person is doing, but I'd love to do what that person's doing. And I think that people really would benefit from management training. Now, I think today a lot more companies, if they move people up the ladder, they offer some sort of management training, but there are so many places you can get it yourself. I mean, there are so many different styles of leadership, and you need to find one that works for you. But being a leader and being a manager are not the same thing. I have had many managers who have worked for me and who I have worked for who were not good leaders. And you can find good leaders in your housekeeping staff at the front line, in your nursing assistant staff, in your social work assistants, in your clerical staff. I think we need to take our leaders where we find them. And I think what I like to see leaders do is to help people succeed. I think nothing is worse than putting people in a position that you don't give them the resources they need to do the job you're asking them to do, or you don't recognize it. I've mentioned the transformational leader, and that to me is the most ideal leader. The transformational leader is a good communicator. They tend to put their staff ahead of themselves. If something goes wrong, they take the blame. If something goes right, all the credit goes to the people who are doing the work. And they help people to succeed. They support people. I think we need to teach people how to be leaders and how to be managers. And as I said, those are two different skills. I think we need to be flexible. We need to realize that if we do something wrong, or if someone else does something wrong, it's not a catastrophe. Even if it is, we can take anything that goes wrong and turn that into a learning experience. If your staff are afraid to make a mistake, it means that they're not being innovative. If people are afraid to try things, the whole company, the whole organization is stymied because people can't move forward. So even if a serious error occurs, a leader can take it. We had so many situations happen under COVID. We had deaths that occurred. We didn't know what the situation was. So many nursing homes were put into really negative light because people had died. But I've been a licensed nursing home administrator since the 80s. I'm not practicing that now. I do a lot of work with nursing homes. I cannot imagine being able to do what needs to be done in a, say, a dementia unit where you had to keep people separated and do all sorts of things. How do you do that? And that was one of the things that we spoke to the governor about when the executive director and I met with the governor is we have people in the, and this was at the beginning of COVID, we had people who were being put into positions and jobs and situations that they were not prepared for. We had people coming in who worked in pediatric and who were being put into ICUs because people were needed, and mistakes could happen. So how are we protecting the employees, the nurses, the doctors, the social workers who are moving into areas that is not their comfort zone? I had a personal experience with that early in my career when I came from pediatrics, which is where I started in my career. And I moved to Nyack Hospital, which was a little tiny hospital in Rockland County at the time. And they made me the assistant head nurse, and then told me that the actual head nurse was going to be out for something like 6 months because she'd had a car accident and a baby. So there I was coming from pediatrics into it was the cardiac intensive care unit, where the doses were different, the equipment was different, everything was different. It was terrifying. It was terrifying. You know who my leadership person was at that time? An LPN. She was absolutely phenomenal. She'd been there for years. I had no qualms about being an RN, learning from an LPN. I think you can learn from anyone. And I think a lot of leaders and managers need to realize that and respect and take into account what information is coming from many different sources. Many times it's your housekeeper or the person who delivers your trays, who knows your patients more so than the people who are actually providing the care. They have more time to spend with you. I hope that answered your question.
Yes, thank you, thank you. And I don't mean to be hogging the question, so please, folks, unmute yourselves and ask the questions. We have just a few more minutes.
Can I ask a question of Caitlin?
Sure.
Caitlin, I was so impressed with your presentation. You covered so much information. You covered it so well, and you gave such a wealth of resources that are available to people, including some that I was not even aware of. I wondered, and you said in the presentation that you monitor, or that somebody monitors that every day so that the information is current. And I know how important that is. If you go on a site and the information you need is out of date, it's a waste of your time. How do you and the hub stay on top of such a vast amount of information to keep that current? I think that could be a learning lesson for all of us.
Thank you, Stephanie. I appreciate all your kind words and the great feedback. It means a lot to me coming from you and Terry. And again, wonderful presentations from both of you. I was learning so much, and Terry, I enjoyed your perspectives about human potential. So beautiful. Thank you. That's a great question. How do we stay on top of it? We work a lot. We're a very small team. As I mentioned, my director, Giovanna Mozo, is here. It is myself and then a few others. We have 2 more program coordinators, Daniela Arias and Victoria O'Neill. And we just try to stay on top of everything going on in the region, whether that is subscribing to everybody's email distribution list, going to many, many meetings all the time. Sometimes it's back to back because we are so much in the community. We try to build capacity and build partnerships and connections so that I can say, hey, Stephanie, how are you doing? What's going on with you? What would you like for us to share? Always keeping informed in our data. And I also have to give credit to Katie Gallo, who from Daydream Communications, who helps us to create our website to make it all look wonderful. And as soon as we get information, we send it off to her and she puts it on our website, our social media, our newsletter as well. So we're all just very attentive to what's happening in the region to the best that we can. Of course, sometimes we may miss something. Again, we're a small team covering a whole lot. So that's why we always ask, what's going on in Greenwich, what's going on in Wilton, what's going on in Fairfield, and we try our best to take all of that and then distribute that out. So thank you for asking. I've never been asked that, but it's really nice to talk about that because it is a lot of work that we do.
Thank you. Yeah, I think what you talked about there was connecting people, I think is so critical. When I first became the Director of Community Health Planning for the Greenwich Department of Health back in 2002, I think it was, one of the things that evolved in that job was being a connector of people. And eventually I had all kinds of people coming saying, I just took this job, or I just started this new position. Who should I know? And it's such a critical role. And it just evolved out of nowhere and became a major component of what I did as a community health planner. So I thank you for sharing that. And Terry, your presentation was wonderful. I love your transcendental meditation and all that thinking. Thank you for sharing it.
Thanks, Steph.
Thank you, Ivana.
I appreciate it. Can I just make one comment though? Caitlin, I want to second Stephanie's comments. It just strikes me that your resource at the hub is probably, unprecedented across, many US states, and just the scope of it, I think it's fabulous. I hope that you guys are getting the right level of recognition and funding and exposure as a model, because if not for mental health, what else do we have? Steph knows better than anyone else. Any physiological impairment, a lot of times, is triggered by poor mental health, and so that's the root cause of maybe a lot of our issues. I just think you guys are doing a fabulous job, and I want to, thank Stephanie and you, Caitlin, and everyone involved, just for giving us this opportunity to speak today. It's been pretty awesome.
And I think thanks have to also go to Giovanna, who's the director of the program, for all that wonderful work. So thank you to your team.
Thank you.
Absolutely fantastic.
I couldn't do it without all of them. They have hit the road running, especially being in our field, being newest in our field. They are just thriving, wanting to learn and just know so much. And, like Caitlin said, it is a lot of work, but we do have that dedication. And Terry, we don't get enough money, to be really honest. I'm constantly trying to get more money. And, we typically would be a one-person show or a two-person show, and just having 4 people now under a program for an RBHO is unbelievable. So I'm just grateful for my team and just having who we have currently. So, but thank you all for your kind words. It really means something. I drill constantly to the team about being that leader in the community, being able to provide or connect people to our resources. We attend 90+ meetings in a quarter. Wow. So we're constantly in meetings and then trying to get our work done too. So we really appreciate it. Thank you.
Fabulous work.
And I just want to jump in. This is Sue. I want to thank all of our 3 presenters. They were fabulous. I think the workshop that we've done, this is the last in our series. So we've had 3 workshops, this being the last one. And I think all of our presenters have been fabulous and have shared a tremendous amount with us. I leave these workshops with my head spinning. So I'm sorry I don't have any questions, but I can assure you, you will be hearing from me again with all of my questions, because I kind of need to digest all this information. But I do know, hearing everybody speak, you guys are doing a wonderful job. I know we have a lot more work to do. We are eager to stop vaccinating people and have everybody be vaccinated so we can begin to really focus on the mental health and the behavioral health component, because we know that is so, so important. For public health, I know we just get, kind of siloed in what we have to do as far as getting people vaccinated. So we are eager to move forward. We are eager to partner with all of you. As we continue to move forward and head out of the pandemic and start, addressing some of these health concerns that have always been here, honestly, but have really increased since the pandemic. So I can assure you, you're going to hear from us again relatively soon. I know Caitlin is going to be presenting at one of our other meetings that we participate in, our ESF 8 meeting. So we will get a video of you, Caitlin.
I can assure you we will get that done and we will send it out to everybody. So with that, I want to wrap up. If anybody has questions for our speakers, you can ask them. If not, you can send them to me and I can get them out to all of our speakers as you guys all had time to process this. And I also do want to thank our participants. Most of you have been here with us from the very first workshop. So I thank you for that commitment and that dedication. And I'm sure that you too, because you came back, have learned that these were very useful. We will take a lot of this information, incorporate it into our regional plans. And we're looking forward to doing that as well. So thank you, everyone. I do appreciate all your help and all you do.
Well done. Well done.
Thanks to you, Sue, and Jennifer Zebel for putting this together. This has been a great three webinars. So thanks so much. All right, I'm gonna